Connecting. HitRadio. Posts. Saan ba makikita pag sa page? Ito mismo, no? Or videos? Hindi din. Ayan na. Okay, we're live now. Okay. Thank you.
Amen.
Amen.
Broadcasting live via Zeno.fm/HitRadio online. This is H.
Oh, what happened?
Broadcasting live via Zeno.fm/HitRadio online. This is HRO. Hit Radio Online. Hit Radio Online.
May bagong virus na kumakalat ngayon at naaalarma ang buong nation. Para di daw mahawa, ito ang solusyon. Kaya sundin mabuti tong instructions. Maghugas ng kamay para virus mamatay. Iwasan ding humawak sa iyong mouth, nose and eyes para COVID-19 hindi na makapuksa. Mag-face mask at mag-alcohol maya't maya. Maghugas ng kamay para virus mamatay. Iwasan ding humawak sa iyong mouth, nose and eyes para COVID-19 hindi na makapuksa. Mag-face mask at mag-alcohol maya't maya. Ang virus ay nakamamatay, kaya makinig, wag pasaway. Stay sabay, wag nang gumala kung ayaw mong ikay mahawa. Mag-face mask kung lalabas, mag-vitamin C ng madalas, at umiwas sa mga matatao. Mag-alcohol para sigurado. Maghugas ng kamay para virus mamatay. Iwasan ding humawak sa iyong mouth, nose and eyes para COVID-19 hindi na makapuksa. Mag-face mask at mag-alcohol maya't maya. Maghugas ng kamay para virus mamatay. Iwasan ding humawak sa iyong mouth, nose and eyes para COVID-19 hindi na makapuksa. Mag-face mask at mag-alcohol maya't maya. Maghugas ng kamay para virus mamatay. Iwasan ding humawak sa iyong mouth, nose and eyes para COVID-19 hindi na makapuksa. Mag-face mask at mag-alcohol maya't maya.
Good afternoon, everyone. Welcome to Coffee Monday. Woo, the newest show on the planet. And of course, the newest show on Hit Radio 100.7 online. Good afternoon, PNP MRF heroes. Of course, my co-host for today is DJ Myla. Hi, DJ Myla. How are you
Hello.
doing?
Yes, a very good afternoon to everyone. It's very interesting afternoon to be with all of you, and we'll be tackling a lot of interesting current matters. So looking
Yes.
forward on that.
Definitely. Thank you, Miss Myla, for joining me on this show. I know you're a very, very busy person because you're with me every Wednesday and Friday. Pero eto, naglaang ka pa ng isa pang araw for Hit Radio and for this special show, Coffee Monday. Thank you so much, Miss Myla.
Yeah, well, it's because we have the MRF heroes, so I'm really looking forward to know more about the existing project that they have. So
Definitely.
let's get it on.
Yes. And of course, our special co-host for today, he is the Chief Personnel and Records Management Section, all right, Chief for PRMS. He manages and primarily responsible for the continuous improvement of the Regional Health Service, that is the National Capital Region Police Office. Ladies and gentlemen, my pleasure, Police Major from Philippine National Police, Sir Ace Salvacion. Hi, Sir Ace. Good afternoon and welcome to the show.
Hi ma'am, good afternoon din po. I'm very excited and very fortunate ma'am, and we would like to thank Hit Radio for this opportunity to be able to showcase po yung ating mga kasamahan na lingid po sa kalaman ng marami na po tayong mga na-contribute sa ating community. The Philippine National Police ma'am na pinamumunuan po ni General Sinas, of course, and then our health service, yung pong madalas hindi po nakikilala ng mga tao na meron pong health service ang Philippine National Police, which is headed by none other than Police Brigadier General Luisito Magnaye.
Wow.
Sir?
Good afternoon, sir. Welcome
Good
to the
afternoon,
show.
sir.
And also, sir, ma'am, di po matatawaran po na meron din po tayong Medical Reserve Force, no? Si Sir Magnaye din po ang ating commander ng ating Medical Reserve Force.
Wow.
Of course, without further ado, ma'am, sir, hindi po ako yung center ng attraction ngayon, kundi po yung ating Medical Reserve Force. Ma'am, please, let's start.
Thank you so much, Sir Ace. And wow, we're so lucky to have you as our co-host. Sana gawin natin tong daily, kung kaya lang ng oras natin, because this is really one of a kind show. Dahil hindi naman lahat ng online radio may ganito. Kami lang talaga pinakaswerte dahil mahal na mahal kami ng PNP MRF. Kaya super thank you, lalo na kay General Magnaye. Sir, thank you so much.
Thank
Ngayon
you.
pa lang po. Ako pa si DJ Gail again.
It's a privilege, really.
Yes, thank you. And well, to start with our program, I'd like to introduce our first guest. He is Lieutenant Colonel Austria to do the opening remarks and also to discuss about the SMO Arena Mega Swabbing Facility, its history, organizational structure, and general overview of the Medical Reserve Force. Once again, let's welcome Lieutenant Colonel Austria. Hi, sir! Magandang hapon po.
Sir, nakamute po.
Ay, nakamute.
si sir.
Nakamute si sir. Nakamute pa rin siya. Sir, nakamute po kayo.
Ayan.
Yan.
There you go.
Ulitin po
Wow.
natin. Ladies and gentlemen, let's welcome Police Lieutenant Colonel Jess Austria.
Isang magandang hapon po sa inyong lahat, DJ Gail and Ma'am Myla Katibayan. And,
Good afternoon.
most especially po sa ating butihing Director ng Health Service, Police Brigadier General Magnaye, sir. And sa lahat po ng bumubuo ng Medical Reserve Force. Magandang hapon po.
Magandang hapon,
Magandang
po,
hapon, sir.
Allow me po na basahin ko na lang po yung background lang po regarding sa Medical Reserve Force. Short introduction lang po. The advent of coronavirus disease has proven to be a real challenge in health systems resilience and response to emerging communicable diseases. Since its discovery as a novel cause for a cluster of pneumonia cases in China, from China, So the Philippines, since its first reported local case on March 2020, has continued to see an increase in prevalence, which prompted the declaration of community quarantine in the whole of NCR. The unexpected outbreak of the COVID-19 worldwide pandemic has greatly affected our country in almost every aspect of human life. And amidst this crisis, the Philippine National Police, upon the instructions of President Rodrigo Duterte, extends every possible assistance to the community in maintaining peace and order and assist the local government in the delivery of much-needed government services. With this, the Philippine National Police has created a medical augmentation dubbed as the National Headquarters Medical Reserve Force, and it is composed of policemen with health-related courses and professions. Amid the rising number of infections caused by the coronavirus disease, several government privately owned structures were repurposed and converted into temporary swabbing facilities like the SM Mall of Asia Arena, the PICC, and the Ultra quarantine facilities.
Yan, medyo frozen si sir. Siguro malamig sa lugar niya. Antay natin. Ayun po,
Malakas siyang AC.
Oo nga, Lieutenant Colonel Jess Austria. He's talking actually about the SMO Arena, yung mega swabbing facility, at binibigay niya yung, kumbaga, konting history. Tama ako, Sir Ace? Ayun.
Ayan, na-resume na si Sir.
Sa pagbabalik ni Lieutenant Colonel Austria.
Yes po. Our swabbing facility has 72 swabbing booths, and we have it is being manned by the Medical Reserve Force, and we have an augmentation, a pool of health personnel hired by the Department of Health right now. So sa ngayon po, continuous pa rin po yung ating RT-PCR test being conducted sa ating testing center. We operated way back May 23. So far po, going strong po yung Medical Reserve Force, and very safe po yung ating, it is safe and efficient yung ating mga procedures because we are guided by this manual of operating procedure. It is the only swabbing facility that has a manual of operating procedure po. And
Wow.
it is being crafted by the PNP Medical Reserve Force para po sa mga
Congratulations. Ang
Right.
galing.
Sir, may I interrupt? Like the 72 testing booths, is it situated in the SM Mall Arena or in PICC, or is it total?
Yes, ma'am, in Mall of Asia Arena. Before, we have 72 testing booths inside. However, nung medyo nagbawas po yung ating mga clients, pinull out po ng BCDA, and they were distributed sa mga airports, seaports, and other LGUs kung saan po ma-maximize po yung paggamit ng ating mga swabbing booths.
Yeah. And then additional question po. Like if you could walk us through inside the arena, like before reaching the swab test itself, do you go through like for a BP or like a physical test, like a counter to do that first before you reach the swab test? Do you have that kind of procedure?
Medyo naputol po, unstable po yung internet natin, kaya hindi ko po narinig yung questions.
Okay, I will repeat my question. So, walking through inside SM Arena, do you have like a first counter to check your BP and then another counter to check your physical exam, something like that, and before you go to PCR test?
Actually po, naputol po ulit. But
Naputol
anyway po,
ulit.
I will try to answer your
Okay.
question.
Siguro si Sir Ace makakasagot niyan kung hindi napuputol yung
Oh,
internet
I think
niya.
Sir Ace have been there. So because we never been inside the SM Arena at this time.
And I
so
don't
we
want
just
to be
wanted
there,
to-
please. Ayoko talaga. Kape po tayo dahil it's Coffee Mondays.
Okay.
I would like to please refer that question to Colonel Tombok Kasi po, siya po
okay.
yung tumatanggap po yung
Physical person in there. Okay. Colonel Tombok, would you like to answer my question?
Siguro po sa next siya, Miss Myla, siya po yung next speaker natin.
Okay, sige.
Yeah.
Let Colonel Colonel Austria to
Austria.
finish first.
Yes, sige po. I'll share with you the ano pala.
Sorry,
Sorry.
excited
Hi,
ako
bye!
masyado.
Okay lang, okay lang. Actually, very interesting tong topic
Yeah.
natin today, DJ Myla. Kasi para at least malalaman ng mga tao, ano ba talaga yung meron dun sa mismong
Yes.
SMOA swabbing facility, di ba? Kasi I'm sure naman hindi lahat nakapasok doon. So at least we have our PNP MRF heroes here. Kasama po natin si General Magnaye para at least i-walk through nila tayo at kung ano ba talaga yung may expect ng mga tao sa loob, yung mga magpapaswab. That's why,
Yes.
it's really an honor to have them here today. So pagpatuloy natin yung overview na binibigay ni Lieutenant Colonel Austria. Sir, please. Sir Ace, ano yata siya? Ayun.
Si ma'am,
Okay.
si sir.
Sige pa.
Anyway, sir, ma'am, nandito naman po si Colonel Joy Tombok po.
Okay.
She happens to be the assistant head natin. And then nandito rin po si Ma'am Jinel, yung pong si Ma'am si Colonel Montemayor. She is our operations officer ng Medical Reserve Force. But anyway, Ma'am Joy, kung narinig niyo po yung tanong ma'am kanina,
Ni DJ
Nawala.
Myla.
Ayan, nakamute din yata si Ma'am Choi.
Sige, tingnan natin. Ayan. Ayun na medyo nalaglag si Ma'am Joy kanina. Nakapasok na ba siya
Sorry,
ulit?
na-disconnect po, ma'am. Sorry po.
Na-disconnect. It's okay.
Oo po, na-disconnect
Sige po.
ako po.
Right. I could repeat po the question.
Sige
Ay,
po.
ako na ba?
Ay, teka, tapos na ba tayo kay Colonel Austria? Sir, are you done with your part?
Some more questions, ma'am? Do you have still more questions to ask?
Sige, si DJ Myla, ano yan, marami siyang tanong talaga. Siya po talaga yung nag-prepare ng questions. Ako po, lang, sundot-sundot lang.
No, it's basically the same question po if the internet is stable already. If you could walk us through inside the SM arena, like if there's like a counter to check your BP first, a physical exam, before you head through the PCR test.
Because of the volume of the influx of clients po, minimal na lang po yung ating assessment na nagagawa. Although we have personnel to screen yung mga clients na pumapasok, the only thing we can do is to check their
Body
temperature and we ask them if how they are doing. Kung
I
meron
see.
po mag-declare na ninalagnat, we'll see to it na we will guide them in such a way na they will be treated in a different way.
Okay. Yun pala yun. Kumbaga, pag may mga symptoms na, lalo may fever, sila talaga yung ipaprioritize. Kumbaga, ihihiwalay na sila, sir, dun sa
Yes, ma'am.
grupo. I see.
Yes po.
Thank
Does
you
that
po.
answer your question,
Yes,
DJ
yes.
Myla? Okay.
Yes,
Thank you,
thank
sir.
you.
Thank you, Colonel Austria. Sir Ace?
yes ma'am. Sir, baka pwede mo rin sir i-inform yung public natin regarding sir doon sa first bago ho makapasok talaga doon, meron tayong procedures prior to that. So just
Yeah.
a general overview sir so that mamaya sir is i-specify po yung discussion ni Ma'am Joy at saka ni Ma'am Jinel regarding sa procedures natin.
Okay. That's good. That's nice. So,
Oh.
thank you so much. Yes, Sir Ace?
I believe Sir Jess, di ba? They need to also follow the procedure na magre-register din po sila sa mga walk-in clients natin. Tama ba sir? Paki-explain nga po yun sir.
Okay.
Yes, Ma'am Gail and Ma'am Myla, we have a procedure being observed in MOA Arena. For walk-in clients, they need to register at the Marina Way. Meron po tayong encoding booth doon being manned by the BCDA. Kasi yung BCDA po, sila po yung partner po namin sa swabbing facility. So, pag meron pong separate na pila yon,
Daghang ulit si sir. Daghang.
Oo nga, talagang nakakatuwa talaga yung internet natin dito sa Pilipinas, ano?
Siguro, siguro
So,
pwedeng mag-off ng camera si sir para
oo, para
medyo
mas ano,
Ah, ganun ba yon? Sige,
camera
yeah.
ang
subukan
i-off po.
natin.
Yeah, it's like when you use Messenger, like if there's something wrong with the
Nahulog na yan,
internet,
sir.
yeah,
Nahulog na
just
sa ano.
use the
So,
audio.
Okay.
anyway, ma'am, Ma'am Joy, pwede mo ituloy,
Yes.
ma'am, yung ni-explain ni sir?
Okay. So, magandang hapon po, ma'am, sa lahat. So, kung may mga walk-in po na clients, ma'am, doon po sila pumipila sa Marina Way. Meron din po doong mga encoders.
Okay po.
Ayan. Okay, kasi parang medyo ako rin ang nawawala. So, may mga naka-station din po doon ng mga encoders, ma'am, for registration po ng mga walk-in clients.
Okay.
So, doon muna. And then, pag na-register na sila sa PRC, platform ng PRC na provide or binigyan kami ng access, so makaka-receive sila ng code po or retrieval code. So, yun na yun, papasok nila sila doon sa loob po for swabbing. Yun namang mga nag-pre-register or like a day before, nag-submit na sila ng data, ini-encode po ng mga encoders namin sa gabi para the following day, doon na sila dediretso sa papasok na sila and then doon na before yun nga yung checking na ng temperature na sinabi ni Sir Estrella kanina. So dadaan din doon pag nakapasok na po sila sa loob, no? Meron din po doong yung parang waiting area nila. So pag ready na po yung mga workers natin, nandoon yung mga encoders, dadaan sila ulit sa encoder for information verification nila kung tama ba yung mga na-encode na mga data nila. And then, pagkatapos po niyan, syempre kailangan din po doon yung identification card nila and also yung PhilHealth card nila. So, para ano. And then, next na po na procedure niyan is yung isa-swab na po sila. Then, merong barcode din na ibibigay sa kanila and then same number po ang ididikit doon sa kanilang specimen para yung pag-follow up po ng result, doon po magre-refer kami sa barcode. Doon po ang maging reference sa barcode. Then, isa lang po yung, bali one way po. So, iba na po din yung exit nila. Wala pong balikan. So, ganun po usually ang proseso na po sa loob. But, yun nga, yung before that, yun nga, sa registration naman ng kanilang, ng mga clients, no, isasubmit nila yung, syempre, yung name, birthday, age, sex, civil status, yung PhilHealth number, email address, yung cellphone number, at yung address, complete nila ang address sa barangay just in case na mag-positive, matitrace kung saang area sila. At saka, kailangan din po sa registration na yung email address is tama and active para doon po nila din ma-receive yung kanilang result po. So, ganun po yung procedure po sa loob ng swabbing facility po.
Maraming salamat po,
Thank you
Colonel
po.
Tombok. Wow, talagang naliwanagan tayo, Bismaila, no? Kung paano yung procedure doon. And talagang si Colonel Tombok, kabisado na niya. Kasi last year pa, I think, Sir Ace, tama po ba ako? Isa siya sa mga talagang mumuno, di po ba? Doon sa, sa swabbing facility.
Correct, ma'am. Lahat, ma'am, yung in-invite, ma'am, natin dito has been in the Medical Reserve Force at the beginning of the pandemic. Talagang ito po yung, sabihin na natin, has been in the front line since last year, for 1 year already. I-clarify lang natin kay Ma'am Tombok ulit, ma'am. Ma'am, maraming nagtatanong madalas, no, kung sino-sino na ba yung nakapag-avail or sino pa yung pwedeng mag-avail ng services ng MOA Arena for swabbing program.
Okay.
Could we add in to us as well if like how much is the fee for that, just for everybody's information?
Ma'am, ang swabbing po sa MOA Arena is free po. Yun nga lang po, ini-require namin ng PhilHealth ID or PhilHealth number. So,
Okay.
So does that mean that PhilHealth has to pay for that, or how is it?
sa tingin ko, ma'am, kasi yun po ang nire-require sa amin ng Red Cross po.
Okay. All right. At
Okay.
least we clarify things so that
Yes po.
whoever are watching right now, then they know how it goes. Yeah.
Pero may
Opo.
mga
So,
walk-ins din tayo, Ma'am Joy. May mga
yes,
tumatanggap
ma'am.
din.
Yes,
Okay.
ma'am, meron po. So, yung nag-umpisa kami, ma'am, meron lang pong inassign sa amin na LGUs. Parang 6,
Mhm.
Pasay, Parañaque, Pasig, Muntinlupa, Makati, and ano pa ba isa? Las Piñas. So nung una po is 6. Pero habang tumatagal po, meron na kaming clients from Cavite, from Region 3, Bulacan, like parang ganon. So iba-iba na pong lugar, and then from Mindoro, Region 4, so sa ngayon po kahit sino po naman ay pwedeng mag-avail
Mag-avail.
nung swabbing service po na ino-offer. And then yun nga lang po, sa ngayon may mga government offices din po na ina-accommodate. So as long as meron sila nung requirement na yung PhilHealth, and then mag-coordinate lang po, and then ang ni-require naman po another is yung like for example yung mga clients natin from LGU, may endorsement sila ng LGU din po. And then yun nga, so sa mga government offices or ibang mga agencies, may iba din mga private agencies, pinapadala lang po yung endorsement ng kanilang head ng office, and then yung mga information din po ng mga clients na kailangan po doon sa registration sa PRC po.
I see.
Basic details.
Thank you so much, Colonel Tambok. Paano, sorry to, tanong ko lang, paano po pag walang PhilHealth tapos may mga nag-walk-in, do you accept those? Yung mga clients na ganon? Pag walang PhilHealth tapos nag-walk-in? Ma'am Joy?
Actually, ma'am, may mga clients kami talaga na walang PhilHealth, pero in-encourage din namin sila na mag-register. Actually, mabilis lang din naman po mag-register sa PhilHealth, and then pag may MDR na sila, yun, pwede naman silang agad na mag-avail ng service. Kasi po, may mga na-advise na rin kami ganyan, mag-register sila sa PhilHealth, makakuha agad ng MDR. So, kinabukasan, pwede na rin po silang pumunta doon po.
I see. Okay pala.
Kasi para naman po, ma'am, so alam mo yun, para naman po, ang ginagamit kasing fund is sa PhilHealth din. So,
yes.
Kawawa din.
Opo,
So,
at
tulong
least
na rin sa
ma-accommodate
government
sila,
po.
opo, di po ba? Yung
Opo,
hindi
opo.
yung kailangan pauwiin pa dahil nga sa walang PhilHealth. Maraming salamat po, Ma'am Joy. Any addition po sa mga information na yun, Ma'am Joy, before we move on sa ating next topic?
So ano pa ba yung kailangan i-ano? So kasi yung isang ko din, yun nga, ma'am po. Yung after na makolekt yung specimen, maayos according to the requirement of the PRC, ma'am, may kasama kaming doktor. Siya po ang in charge doon po sa coordination with PRC as regards the examination po ng mga specimen. And then si PRC na rin po ang provide ng result directly doon sa email ng bawat client din po.
Right.
So ganun po. And then ano pa bang kailangan kong i-discuss?
How many
Sige, go ahead, Miss Myla.
How many days na po, like, for you to get the results? Kasi we have improved a lot nowadays, right? So, like, in SM Arena, how many days na po ngayon for them to wait to
Bago
get the
makuha yung
results?
result.
Yeah.
Okay pa, ma'am. Actually, ma'am, previously, ma'am, within 24 hours, nare-receive ng client yung result. Kaso lang, sa itong panahon, ma'am, na talagang umakyat yung cases number of cases natin, and then hindi maiwasan na ang PRC personnel or ang PRC mga examiners or ibang mga workers nila, encoders, ay nagpa-positive din at kailangan din mag-quarantine. So sa ngayon po, ang na-observe namin since last week is 2 to 3 days po. Kasi dahil nga sa kulang ng workers nila dito, yung iba po ay dinadala pa po sa branch nila sa Clark and Batangas po. So binabiyahe pa po nila doon. So medyo may delay.
Pa talaga.
So hopefully baka kung makarecover na rin yung personnel nila, sana maayos din, mapabilis din po.
Maraming salamat po. Ayun.
Ganun po.
Okay, thank you so much, Ma'am Joy. And nais ko rin itanong, sino-sino po ba yung, ano ba yung, kumbaga, sino yung mga kasama dito sa MRF? Kasi alam ko may mga volunteers din tayo, Sir Ace, di po ba? Ma'am
Ma'am,
Joy?
for this one, ma'am, may we refer now to our operations officer, ma'am.
Okay.
Si Police Colonel Jinel Montemayor. Ma'am,
Ay,
ma'am,
okay.
ma'am Jinel?
Good afternoon po, Colonel Montemayor. Welcome po
Good
to the
afternoon.
show.
Good
Good
afternoon, ma'am.
afternoon.
So I guess I believe si Colonel Montemayor she'll be discussing about the operational processes of the facility to include how to avail and coordinate for swabbing by other government agencies and the general public, as well as my question a while ago kung sino-sino po ba yung kasama dito sa MRF and maybe as well the duty schedules ng MRF dyan sa MOA swabbing facility. Ma'am Janelle?
Yes, ma'am. We have started the procedure. It's already mentioned by Colonel Austria and Lieutenant Colonel Austria and Colonel Tombok with regards to the registration. So, doon na po tayo ngayon in the beginning po kasi, nagkaroon po ng coordination with the LGUs as mentioned by Colonel Tombok, yung Pasay, Pasig, Las Piñas, Muntinlupa, Makati. It's more on the southern part of Metro Manila.
Okay.
And then nung nag-evolve po yon, and then before we do the coordination with them, with the LGUs, we have to go to the municipality to advise them to mag-coordinate sila na mag-undergo ng swab test, and then ang ka-coordinate ko that time yung mga RESO, yung mga municipal doctors at saka yung mga LGUs para sa pre-registration. But right now, since tumagal na po yung sa present po dahil kumbaga nasanay na sila at alam na nila yung how to register and what are the do's and don'ts inside the facility.
Okay po. Meron yata naka-on yung yung monitor. Pwede natin hinaan kung anong merong monitor dyan, like gadgets, para hindi lang siya mag-echo. Sorry. Ayun, nasa na si Ma'am Janelle? Nalaglag siguro,
Ayun.
Ayun.
Still here.
Okay pa, okay pa.
So, since we have established already the coordination mechanism with the LGUs and at the same time with the law enforcement agencies, yun po yung AFP, NBI, PDEA,
Okay.
PCG, and PNP, at saka sa mga iba pang LEAs, law enforcement agencies. Pareho lang po yung procedure that they have to submit endorsement. Kasi yun ang requirement. And with that endorsement, naka-attach po yung details as mentioned by Colonel Tombok. And then pag na-register na po sila, they have already the retrieval code ng PRC sent to their email.
Oh,
And then,
pala ka-high-tech yun. Okay. Oo.
Pag natanggap na nila yung retrieval code nila sa personal email nila, ma'am, then pwede na po silang pumunta sa MOA Arena anytime during the swab operation, which starts 10 o'clock in the morning and it ends 2 o'clock in the afternoon. Only this time po na 10 to 2 o'clock. But in the beginning, we swab po na unlimited kasi po nag-maximum pa kami ng 3,000 ng isang araw.
Oh my God.
Before. Yes, that was last year.
year.
During the peak of the month of June, ng June, July, and August.
Oh my
Nag-peak
God.
po kami ng 3,000 before. So, medyo nag-stabilize yung, yung swab operation natin. I mean, kumonti na rin yung nagpapaswab. So, starting ng mga November, so, nagre-range na lang ng maximum of 1,000 plus
Dami
yung
pa rin.
nagsuswab.
So that's
Yes,
the average po, like in a day.
Average right now is around 1,000 plus lang po ngayon, ma'am,
Oh my God.
yung nagsuswab. Yes. So far, with the operation mechanism itself sa loob ng facility, yung mga swabbers natin, supervisor, scanners, and then encoders. Yun po yung encoders, ipapakita po doon yung retrieval code and then your ID. Tapos bibigyan ka po ngayon ng barcode. Para nang sa ganun, yung barcode mo na yon, you could monitor sa sarili mo through that barcode sa system. Malalaman mo yung flow kung saan ano nang nangyayari po doon sa swab test mo.
The result.
Ano yun? Parang app?
Yeah.
Kailangan i-download yung app? That's where you
At
can
least,
track?
ma'am, you click the link of the Philippine Red Cross and then you enter your barcode and then you could
okay.
monitor already the track or the flow of your own specimen. Nakalagay doon na alang na yung specimen, tapos and then ganun ma'am, tapos magre-reflect din doon yung kung negative or positive ka, i-email ka, nandoon makikita mo sa email mo, ma'am.
Yeah.
Okay. I guess yung next service, yun po ba yung next guest natin ang mag-explain kung anong mangyayari kung positive yung client?
Mamaya pa yan, ma'am.
Mamaya pa. Okay. Na-excite ako. Sorry.
Yeah. Si Ma'am Janelle din, ma'am, because she is our operations officer.
Okay.
Madalas, ma'am, ang nakikita lang natin as clients, kung kunyari, ma'am, ikaw ay nagpa-swab sa MOA Arena,
Yes.
madalas makikita mo lang, ma'am, na sinaswab ka or yung pagdadaanan mo. Pero marami, ma'am, ang hindi nakakakita o hindi alam, ma'am, kung what happens before nag-i-start yung swabbing, and then yung parang after na natapos ka na mag-swab, ano na nangyari dun sa result mo?
Yes.
Or yung sample mo, what happened next? So,
Yes.
I think Ma'am Janelle can expound on this topic.
Okay.
Ano yung mga preparatory, ano yung mga requirements, and as well as ano yung what happens next after na maswab ka. And then, ano na po nangyayari hanggang sa makarating siya sa Red Cross? Ma'am Janelle?
Yes, on the, as mentioned sa preparation, so mayroon ka na pong barcode and then isoswab ka na po ngayon, may barcode ka na, isoswab ka, and then after yung pagkuha po ng specimen sa'yo sa nasal at saka oral po, na isoswab. And then you will be advised to do the isolation until the result will come out. Para ma-avoid po yung cross-contamination in your family or kung sino man ang nakakasalamuha.
Okay.
So habang naka-isolate siya sa bahay nila, kung nag-positive, susunduin na po sila ng barangay.
LGU.
Kasi yes, ma'am. Kasi po, yung resulta na ipo-forward po yun ng Philippine Red Cross doon sa mga RESU or municipal doctors.
Kaya
then,
nalalaman nila agad kung sino yung mga positive
Yes,
dun sa
ma'am.
area nila.
Yes,
Oh,
yes, ma'am.
Okay. I see.
I will just
Opo.
cite my experience because I was a COVID-free. I was a COVID patient before. That was month of May. And so when I got the result, when I had the test from Red Cross, so when I got home, of course the transportation sent me back here in my place, and so I was just asked to take care of myself because I was just living alone, and then I have to declare to the barangay. So it was not I was not told that the Red Cross has to coordinate with the municipal. I don't know
LGU.
about that, like you guys are mentioning right now. So it was like when I communicated with the barangay. So yeah, they just like it's not consistent that they're checking your temp, but I was asymptomatic anyway. I just got the itchy throat and that's it. I never had the fever or loss of taste or loss of smell and stuff like that. So I was lucky enough to just have the itchy throat and that's it. So yun lang. So the barangay was just like, it wasn't that consistent, but maybe because it was not severe for me, so that's why it was okay. But yeah, it's good to know that the Red Cross is the one coordinating with the municipal.
With LGU.
Because
na
like
mismo.
all I thought on my end is that I just because I reported it
inform
to the
them.
barangay.
Oo.
Yeah.
Saan po ba kayo nagpa-swab noon, Miss Myla?
It was in Red Cross in where is it? What's the nearest here nearby Magallanes? Sorry, I'm not so good in place.
Okay. So hindi
Pasig.
po doon
Pasig,
Pasig.
right?
Okay.
Yeah,
So hindi
yeah.
doon sa hindi mismo sa MOA. Hindi mismo
No,
doon
no,
sa
not in
facilities.
MOA. No.
I
But
see.
at least it's just like a comparison of how things goes, like how you guys do and how it goes to other facilities. Yeah. So it
Thank
just
you.
like,
Yes, Sir Ace?
Ma'am Janelle, can you give an idea, ma'am, what happens prior, ma'am, na mag-start po yung operations natin? I remember, ma'am, kayo, ma'am, yung madalas na busy, ma'am, dito, no, na bago ho mag-open yung MOA Arena, kung hindi nyo po, ma'am, na itatanong yan, sila Ma'am Janelle, sila Sir Austria, they're busy, ma'am, preparing before mag-start po. Yan, ma'am, yun hindi
Okay.
nakikita na, ma'am, ng mga tao. Ma'am Janelle?
Okay, ma'am. Sir, ang nangyari nung mag-uumpisa pa lang po yung MOA Arena, we started with conducting training. So trinain po namin yung swabbers on with regards to donning and doffing, because with that mapoprotektahan mo yung sarili mo kung na hindi ka mak-contract na sa COVID as direct medical frontliner. So, tinuro po doon yung donning and doffing, tapos how to do the swab, yung paano ang pag-conduct ng pag-collect ng specimen through swab. Tsaka yung as I remember noon with regards to the yung tinatawag naming entry and exit na kailangan isang direction lang yon para yung walang cross contamination, hindi siguradong hindi mahahawaan yung kapwa niya pag nandoon na sa loob ng facility. As I remembered, si Ace noon, siya pa ang naglagay ng mga arrows doon sa sticker doon sa floor.
Wow, grabe.
Yes. Oo, kasi kailangan kailangan ito yung entrance, ito yung exit. At saka we ensure na walang cross contamination with regards sa patient. Ito yung patient lane, ito naman lane ng mga medical operators doon po sa loob. So
that's very good.
opo, so talagang intensive training. After the training, we started the operation sa loob, and then yung sa operation namin una konti, tapos biglang dumami. Tapos pag dumami, inaabot pa po kami noon ng madaling araw pag uuwi na kami. Tapos basa pa yung buhok mo, pagkagising mo na naman kinaumagahan. Basa pa yung buhok mo, maliligo ka na naman kasi may trabaho na naman po noon. Ganun po yung inabot namin noon. Tapos, para lang po hindi naman mag-weaken yung aming resistance, umabot din po kami na ang supervisor na mag-train sa kapwa supervisor sa loob. Kami nila daily magtalaga ako doon sa loob ng supervisor of the day. So hindi ka pwede araw-araw kasi hihina ka din po.
Yeah, because you have to take care of yourself as well.
Yes, ma'am. Kasi we are avoiding overexposure kasi pag nag-weak yung resistance mo,
mas madaling tamaan.
Mas madali kang tamaan po. So, ganun po yung mga pinagsimulan namin nila Ace noon. So, sobrang napakahirap, and then with that nagtagal po kami na malalakas po kami because we followed the strict protocols.
Wow.
With regards to cross contamination and protecting ourselves during the operation.
Wow, grabe. I'm sure nami-miss nyo na si Sir Ace.
Opo, sobrang sipag po niyan.
Grabe nga. Hindi talaga halata na masipag si Sir Ace. but I'm pretty sure talaga napakaswerte ng MRF team dahil nakasama nyo si Sir Ace. Although,
trainer natin.
Yeah, talagang naging maayos yung patakaran, yung procedure nung nandun
it
si
became
Sir Ace.
systematic. Yeah.
Oo, systematic talaga. And I'm sure nag-iwan talaga ng maayos na sistema si Sir Ace before he went to his other kumbaga mission.
Yes,
Being in a
precisely
PNP.
po. Malaki ang contribution ni Ace.
Wow.
Okay, ma'am. Ma'am, move on na tayo, ma'am. Move on.
Baka daw pabalikin si
Sir
Sir
Ace, magpakape ka daw. Oo, magpakape. Ako, I always have this mug kasi I always want to have coffee, lalo pag may show. Magpakape si Sir Ace dahil talagang good job. Oo.
Okay, ma'am. Ma'am, ano ko naman, ma'am, i-segue ko. Anyway, ma'am, pasalamatan ma'am natin, ma'am, si Ma'am Janelle. Ma'am, thank you po sa
Thank you, Miss
information.
Janelle.
Thank
Thank
you.
you.
Move on, ma'am, tayo kay Ma'am Annabel. Ma'am Annabel,
Hello po
hello.
sir, good afternoon po sa lahat.
Ayan, si Ma'am Annabel naman po, ma'am. Ito, siguro, ma'am, madalas na-overlook kasi, ma'am, ng mga tao yung importance ng tama ba, Ma'am Annabel? Kayo po yung sa laundry matters natin ng mga MRF.
Yes sir, tama po kayo
Oh, okay.
dyan.
Okay.
Good
So,
afternoon po.
Good
ma'am,
afternoon po ma'am, good
hindi niyo po,
afternoon
ma'am,
sa lahat.
naitanong, ma'am, na karamihan, ma'am, ng tao. Ilan na ba yung tao natin, Ma'am Annabel, na kailangan mong araw-araw na atupagin dahil sa kanilang mga laundry matters? And why is it important yung laundry sa isang
As,
swabbing facility? Paki-explain nga, ma'am.
yes,
Okay.
sabihin ko itong aking function as a focal person for laundry. I'm in charge with the laundries of our personnel of the PNP and UH Medical Reserve Force during their entire operation at MOA Arena Swabbing Facility.
Mhm.
And also laundries at the respective hotels kung saan sila nakabilit. Also, nasusupervise din ako din sa proper handling and segregation of their laundries to avoid contamination.
Mhm.
And then further, responsible din ako in the coordination of our laundry provider for the pick-up and deliveries of our
Wow.
laundry. And also, yun nga po, aside from my main task, I also supervise, assist our swabbers and workers in the wearing of the PPEs during their donning process.
Mm.
That's all, sir.
May I ask about the laundry thing? Like, are you guys using disposable PPEs or like washable PPEs? Or is it advisable to have the washable PPEs?
Ma'am, ginagamit namin disposable PPEs po, ma'am, to avoid cross-contamination na rin at for the safety ng ating mga swabbers.
Right.
Oh, okay.
Yeah, I guess so.
Yes, ma'am.
Wow.
Thank you po.
Thank you, ma'am.
Annabel, can you
Yes,
give
sir.
a specific situation issues and concerns regarding sa mga laundry natin? Kasi parati ko na monitor yan minsan sa ating chat group. Minsan nagkakaproblema yata tayo sa laundry. Can you give a funny story on your side in your job?
Okay.
Humor us.
Yes, sir. Napakahirap talaga kasi nagkakapalitan. So, buti na lang po may barber
Ay,
bawat
nagkakapalitan.
minsan, nagpo-post ako, nakakahiyaman, nagpo-post ako sa mga may underwear, nagkakapalitan, mga medyas, nagkakapalitan talaga sila siguro sa dami ng mga laundry din na nakinikater ng ating laundry provider. So,
Oh my
naiintindihan
God.
naman natin yon.
Right.
Pero dahil sa kumbaga technology natin na ganyan, na mayroon tayong Viber group, na monitor nila yon, sasabihin nila, mine. Yun lang po. Yes, ma'am.
Oh my.
Miss Anna, may mga color code ba yung mga underwear na yan?
Yes,
Oh
ma'am.
my
Minsan hindi ko na nga
goodness.
sinasabi, personal message ko na lang po, ma'am, para hindi nakakaya. Kasi minsan, ma'am, hindi na sila nagmamine.
Oo, kasi
Oo nga
imagine,
naman.
di ba? Imagine pag ipopost mo pa yun, eto, kanino to? At saka hindi naman kasi usual talaga nalalagyan mo pa ng name, di ba?
Yeah, of course. Kasi it's like your underwear.
Oo,
Yes, ma'am. Ang my name
seryoso
lang po,
tuloy
yung
mga
sa
boys dito.
individual. Yes, ma'am. Yan po ang my name lang po, yung individual laundry bags nila, nilalagyan ng name at saka yung room number ng hotel para ma-identify kung kanino po yung laundry.
Yeah. Kaya lang kasi, syempre, pag nasa laundry na kasi, halo-halo na kasi yun, di ba? Hindi naman nila
Oo,
nilalabahan
totoo.
yun per person eh. Di ba?
It's all together.
Oo, sa mga...
Pino-advise namin, ma'am, per person, pero siguro during yung pagtutupi, Ganun,
Ah,
ma'am. Kaya
Okay.
in-advise talaga namin sa laundry
Kasi, I
provider
mean,
namin na
it's
bawat isang
hygienic, right?
tao.
Like when
Yes, yes,
your
ma'am.
underwear, you know.
Yes, ma'am.
oo.
Pero sa totoo lang, ma'am, in-advise ko na lang sa kanila kung okay lang kung dun sa hotel na sila na maglaban ng ng ano ng
Oo, yung
underwear nila.
ano.
Oo.
Yes,
Yeah.
ma'am.
Oo, para hindi naman magkakaproblema, 'di ba? Thank you for sharing that. Talagang
O, diba?
oo, it will
Kumbaga, every
happen
single
talaga.
details, it has to be all discussed. Kasi it's very important, you know, the underwear.
Oo, at saka hindi talaga malayong mangyari yung mga ganun. Kasi syempre sa dami ba naman ng laundry daily, lalo na last year, 'di ba? Dami kasing
Yeah.
nagpapaswab.
And how
So,
busy they are, you
oo,
know.
umaabot sila ng madaling araw tapos konting oras lang, bangon na naman. So there should really be someone to do their laundry. And thank you so much, Ma'am
Mhm.
Annabelle, for taking
Thank
care
you
Yes.
of
din po,
that.
ma'am.
Opo. Sino po ba yung nag-handle naman, Sir Ace, yung sa food and billeting requirements naman ng MRF? Si Ma'am
Oh,
Annabelle din po ba yon? Yung sa
hindi
pagkain?
ma'am. Si Lieutenant Dugan ma'am at saka yung sa billeting ma'am yan. For info ma'am, marami tayong
Okay.
ma'am na um, billeting options. Before
Mhm.
ma'am, maraming hotels na iba't iba. Pero right now
Mhm.
ma'am, alam ko parang pinag-isa na lang ata nila or ilan na lang ba? Hindi ako ma'am, medyo nawala na ma'am ako dito. Ma'am Joy?
Mhm.
Ma'am Joy?
Yes.
Ma'am, ilan na lang po ba yung hotels na tinutuluyan po ng ating mga swabbers?
Oo.
Actually, isa na lang is yung sa 101 na lang.
Kasi ma'am,
Oo, doon na
Mm.
sila lahat.
matandaan nyo ma'am before, kaya nagkaroon ng problema yung laundry. Yung iba nandun sa ibang hotel, yung iba nasa ibang hotel. Just imagine ma'am,
Oo.
Distribute, hindi rin na ano.
yung,
Oo.
yung laundries natin ma'am.
Oo. Ay, Ace, gusto ko lang, Ace,
Yes ma'am, go ahead.
oo, gusto ko lang magdagdag yung about doon sa laundry. So baka kasi ah, ano ba ma-misinterpret na kaya pino-provide ang ng laundry service pala yung mga workers natin, ma'am.
Mhm.
Kasi after na sila ay mag-swab sa loob, considered kasi sila na parang medyo baka para maiwasan na rin na ma-infect din sila or no. Nire-require actually sila, ma'am, after sila mag-work, nire-require sila mag-shower doon mismo sa may provided na area doon para mag-shower sila and then
Mm.
magbihis para
Okay.
pag-uwi po nila is malinis sila sa room at hindi sila nagdala ng virus. So yung
I see.
laundry nila is doon mismo sa MOA pa lang,
Mhm.
doon na nakabalot na may pangalan at saka yun kinokollect, yun ang sinusupervise ni Ma'am Annabelle. So
Mhm.
para pag-uwi po nila
Yes,
doon
ma'am.
sa kanilang billet is malinis po at wala po silang dalang mga makakontaminate sila sa mga hotel staff. So parang ganun po ang sistema. So
I
wala
see.
silang dadalhin maduming damit at required sila mag-shower after ng work nila po.
Yeah, that
I
made
see.
it clear.
Thank you so much,
Opo.
Yes,
Ma'am
ma'am. Thank you,
Joy,
ma'am.
for clarifying that. Ngayon, bago tayo magpatuloy, nais ko lang basahin itong isang napakagandang comment from Ramon Grace Ipil. Nasa live ngayon. Ang sabi po niya, me and my wife, Mary Grace Ipil, were able to avail twice already the services of SMOA swabbing facility. We can say this PNP MRF unit contributed significantly to control and monitor the COVID-19 in Metro Manila and nearby regions. Our snappy salute to the officers and staff of PNP MRF. Of course, kasama dun si Sir Ace. Thank you so much. Ayan po,
Congratulations!
maraming salamat. Oo, nakakataba ng puso
Diba?
pag ganito, 'di ba? Mas lalo kayong
It's good
gaganahang
that they
mag-work.
give their acknowledgement. Yeah.
Yes, that's right. Maraming salamat sa lahat mga nanonood sa live ngayon. Ating Philippine Online Games Group, kasama sila Rich Kai, and of course our Hit Radio family. Maraming salamat. Nais ko ring batiin ng magandang hapon si Kirk Andy Rupa. May God bless us all po. Maraming salamat po sa inyong lahat. And of course to all the PNP Medical Reserve Force na nanonood ngayon. God bless you po at mabuhay kayong lahat. Sir Ace, pagpatuloy po natin sa pagbabalik, I'll just need to play this video dahil sinusuportahan din natin ang Rotary Club of Makati Ayala Triangle, sister club din ng Rotary Club of Alabangdang Hari. Meron po kasi silang fundraising show on April 16 and nais nating silang tulungan i-advertise tong show nila at kung sino po yung mga gusto mag-avail, makikita nyo po dito po sa poster yung details. Panoorin po natin ito. Ayun po mga kaibigan, that's going to be on April 16. Tuloy ang himig ng pag-ibig. Yun po for the benefit of Tuloy ang foundation. Maraming salamat. And I'd like to say good evening to CP Presi Yulo ng RC Mat. Ayun po. Now let's go back to our show. Sir Ace, sino po ba yung next guest natin at ano yung magiging topic niya para sa ating show ng Coffee Monday?
Thank you, ma'am. Ma'am, we have with us today, ma'am, Police Captain Acosta.
Okay.
Si Pau, kung hindi niyo po maitatanong, he is actually from the Crime Laboratory Services.
Wow, okay.
Magtataka kayo, ma'am. Ano ba to? Mag-i-imbal sa mag-imbal
Doktor ba? Doktor po ba si si Police Captain?
Doctor. Yes, ma'am.
Doktor siya.
Pero dahil ma'am pandemic tayo, so ginamit po siya as a medical reserve force, and his experience actually was in the quarantine facilities. Well, anyway, I'll give way for Captain Acosta o si Doc Pau para magbigay lang po ng konting idea on what he has been experiencing before, ano ba yung nangyari before sa kanya as medical reserve force, and at the same time educate our public and increase public awareness on what if, no? So na-swab ka, nag-positive ka, what is the government doing regarding ano yung mangyayari sa iyo and how you are being isolated. So Doc Pau?
Hello, good evening. First, I would like to greet our commander and director of HS, General Luisito Magnaye. Sir, good evening, sir. And to all other officers of Medical Reserve Force, to Sir Jess Austria, our Deputy Commander and Head of MOA Swabbing Facility, Sir Ace, our Operations Officer, Colonel Montemayor, and Ma'am Tombok, Colonel Tombok. And of course, to our host, DJ Gail and DJ Myla. Good evening to you.
Hi,
and
Doc. Magandang gabi, Doc pa. Welcome to the show.
Thank you for having us.
Nagkape na ba kayo, Doc?
Yes, of course.
Very good. Dahil required dito, kailangan magkape muna bago makapag-umpisa ng show.
If you can send me one also, it's welcome.
Sige po, pati ko idaan dito sa
Virtual
screen.
coffee. Virtual coffee.
Ayun.
So, basically to our viewers, I was tasked to discuss what happens if you tested positive for COVID-19. So
Yes.
that's after the undergoing MOA swabbing facility and other swabbing facilities around the country.
Opo.
So here in NCR, through efforts of the government, they converted two big facilities to cater to COVID positive patients. So of course, we cannot afford to overwhelm our current healthcare systems, hospitals, ganyan. So to reserve the moderate and severe patients with COVID-19, the government converted PICC, Big Tent, and Ultra Coliseum, I guess, into what they used to call quarantine facility. But right now kasi, they are basically functioning as an isolation facility. That's more proper.
Okay. I see.
Yes. Kasi the quarantine facility is basically initially for those in close contact but not confirmed positive yet. But for now, we are functioning as an isolation facility for confirmed positive patients.
Okay.
So I guess the viewers and all of you are wondering, what is it for and how do we avail of its services?
Yes.
So basically, PICC and Ultra are isolation facilities na completely run by PNP. It's just one of the isolation facilities around the country.
Parang extension po ba siya, sir, ng doc ng MOA? Swabbing facility?
Actually, we work together with MOA. So MOA is
Okay.
basically tasked with the swabbing,
Okay.
and then we handle the patients when they tested positive.
I see.
Okay, so first I have to clarify what is it for.
Yeah.
So basically, like I mentioned earlier, if the patient who tested positive for COVID-19 are suffering from moderate to severe, we still advise to proceed to the hospitals or healthcare facilities na both local and private for assessment.
Okay.
And then if they are classified to be belonging within the mild or asymptomatic, then the isolation facilities are for them. So basically, both facilities and like other isolation facilities around the country, we cater to recovering patients or those with mild symptoms only. So the public has to understand these are not makeshift hospitals. They are just there to monitor the status of the patient and then eventually clear them and assess them if they are already cleared for community immersion after testing positive. Okay. With that said, I guess what you are waiting for is how to get in touch with these facilities.
Yeah.
So,
But before that, Doc, nais ko
yes.
lang itanong kasi ano po ba yung pagkakaiba ng quarantine tsaka isolation? Kasi lagi ko siya narinig. Sabi ko, ano kaya
Yes.
pagkakaiba nun? Hindi ko talaga ma-identify kung ano yung difference nun. Could you enlighten us about the difference between isolation and quarantine, Doc Pau?
Sure. My pleasure. So, basically, most people kasi ngayon, they use isolation and quarantine interchangeably.
Opo, yeah.
By definition, they are not, and there's a big difference between the two. So, isolation is recommended for those patients who are confirmed positive with SARS-CoV-2 or having COVID-19. So, they are confirmed cases and needs to be separated from the general public perceived to be healthy. So, it's for the protection of the general public.
So,
And
yun
then,
po yung isolation.
yes, for quarantine, these are term for the patients who are inadvertently exposed to possible sources of COVID
Okay.
or being suspected of having COVID. Like they manifested with symptoms but haven't undergone any testing yet or any confirmatory test yet. So
Okay.
they are advised to undergo quarantine and then subject to testing.
Subject for testing.
Yes.
Okay. Okay.
Okay, so basically that's the difference between quarantine and isolation. So it applies
Right.
to who are labeled to who are advised to go into isolation or to place themselves under quarantine. So basically a good example uh, to picture this is if you're doing home isolation, like if you're exposed, then that's quarantine.
Right.
Sorry, home quarantine, I mean.
Home quarantine.
But
Okay.
if you tested positive or confirmed case ka, then you have to undergo isolation.
Isolation na. Okay.
And you have to be monitored also.
Okay. All right. Thank you, Doc
So,
Pau,
Yeah,
for
I
clarifying the
have
difference.
I have a follow-up question, Doc.
sure.
Like for those were sent to isolate, for example, mild severe and stuff, and then they're required to take antibiotic or something. So like the expenses has to be coming from the patient, or is it like the where they were like quarantined, for example, in a hospital or isolated? So where the responsibility of expenses? So who's supposed to absorb that?
Basically, the big question there is, where did you avail your services from, your healthcare needs services from?
Mm-hmm.
So of course, kapag private yun, the general public has to understand that siyempre, they have to be responsible for the expenses incurred when
Okay.
admitted.
Mm-hmm.
But the government, through PhilHealth, has been of great help to people, both private and indicted side.
Okay.
So, PhilHealth Act, I think, is paying for a big chunk of the bill incurred
Mm-hmm.
while
Right.
both in the hospital. Kasi in isolation facilities, if you remain asymptomatic and just for monitoring purposes, you don't actually pay anything at all.
Okay, but for those like home quarantine, but they are positive, and since they're like for now, there's not much of facilities which is available like the hospital, so they were just like asked to home quarantine, and then they were like yeah, of course, still communicating with doctors, and they were advised to take antibiotics. So for that matter, they are like the patient themselves are the one responsible to pay for their
Yes.
medicines,
Mm-mm.
Yes.
right?
Yes.
Okay, clear. Thank you.
Thank you so much, Doc Pau. Any addition to those information, Doc Pau, before we move on sa ating next guest speaker for today?
I guess it's worth sharing on how to get in touch with these facilities to avail of their services.
Mm-hmm.
Because the purpose of the government in establishing these quarantine facilities
Mm-hmm.
are actually to help decongest the hospitals, which are now nearly full capacity here in
I
NCR.
Yeah.
see. Okay.
So
Ayan.
basically, of course, all patients have to be initially assessed.
Okay.
Uh, the isolation facilities I mentioned earlier, namely the PICC and Ultra quarantine facilities, are actually labeled as step-down care units.
Mm-hmm.
This is their main function. So
Okay.
basically, these are made for patients who are previously admitted for having a moderate to severe, and
Okay.
then on the road to recovery or
Mm-hmm.
greatly resolve their symptoms. Then they can opt to be cleared from hospital service because I know it's very expensive.
Yeah.
And then they can request to transfer sa step-down facilities natin to save expenses.
I see.
Mhm.
One more question lang. Curious lang ako. Pag sa public hospitals po ba, libre po ba pagka na-hospital yung mga COVID patients? Who can
To
answer?
ascertain, yes, unfortunately, to answer that question, pag government hospital, the PhilHealth pays for just the majority, not all. Because there are some medications kasi not under the DOH list of medications.
Mm.
Um, Unfortunately, are prescribed for management of severe cases of COVID. So
Okay.
for that, they have to pay for that. But for other services, usually the PhilHealth pays for that.
I see. Thank you. Thank you so much, Doc Pa. Maraming salamat. And we're very lucky to have you, Doc. At least naliwanagan din po tayo, of course, especially the viewers, kung ano ba talaga yung difference ng isolation and quarantine. Si Alana, actually hindi siya nakapag-join today, medyo busy lang, but she's very happy to know the difference din between isolation and quarantine. And thank you also, Doc Pao, for clarifying also on other issues din, lalo na yung sa pag being hospitalized, 'di ba, yung mga isolation facilities. But I think we just also need lang to give information sa public yung kung saan ba sila tatawag pag sila ay may mga ganitong simptomas. Maybe we could give the contact numbers later kung sino
Yeah.
pong meron, pwede natin i-share sa screen yon para po makikita rin ng mga ng ating mga viewers. Sir Ace, do we have those information? Kung saan po sila
Um,
pwedeng tumawag?
yes, ma'am. Meron po tayo, ma'am, doon sa ating Facebook page.
Okay.
We will again, ma'am, reiterate that one by reposting our
Yeah, repost.
yung mga um, numbers to call. Lalo na
Yes.
po sa PNP, meron po tayo mga hotlines na pwedeng tawagan sa health service.
Right.
Sa mga police stations natin, ma'am, they can also call them. And at the
Mhm.
same time, ma'am, yung ating government facilities, marami na po tayong mga na-share po na numbers that they can call.
Thank you, Sir Ace. And
Good.
of
Thank you.
course, baka may mga nanonood dyan. Maybe you have more than enough mga PPEs or mga gloves or anything na hindi nyo na siguro kailangan. Kung gusto nyo po i-donate, well, pwede nyo po i-donate yan sa ating mga PNP MRF kasi syempre malaking tulong din po yan. Lalo na, syempre di ba tuloy-tuloy pa rin ang pag-swab. So kung meron lang kayong extra or kung may malaking puso kayo that you really just wanna help our PNP MRF, very much welcome po for any donation. So maybe with that, you can just contact PNP MRF, yung kanilang Facebook page. Pwede po kayo mag-send ng message doon for any donations that you would like to send. So ako na po mismo in behalf of Hit Radio, lumalapit po sa inyo, nakikiusap, if you have anything lang, siguro kahit mga masks, Sir Ace, kung ano yung kaya nila or yung mga face shields or anything na magagamit po sa swabbing or sa hospitals. So, yun po. Alam ko marami naman talaga dyan, gusto talaga nila mag-donate, kaya lang hindi lang nila alam talaga yung proper channeling or hindi lang nila alam kung saan talaga nila i-donate. So mga Rotarians, fellow Rotarians, mga malalaki yung puso na mga yan. Hello po sa inyong lahat. Ayan po. This Coffee Monday is actually exclusively for our PNP MRF and of course NCRPO dahil marami pa tayong pag-uusapan sa mga susunod na Mondays and marami pa po kayong matututunan and madidiscover about our our PNP MRF dahil sila po yung ating mga silent heroes, kumbaga. Sila yung hindi mo nakikita araw-araw sa social media na nagyayabang, kami, nag-swab kami, ganito karami, kami, ganito, ginawa namin to. They are our silent heroes. That's why we have to pray for them. And, you just really have to be considerate din. Minsan, syempre, nagkakamali din, di ba? May mga lapses, maybe, pero tao lang din. So, we just really have to cooperate. Tulungan po natin ating PNP, MRF, ang ating government. And prayers really are very, very important. So, yun. Sir Ace, I guess we have to move on with sa ating
Yes, ma'am.
next guest. Mhm.
To culminate, ma'am, this program, we have in our midst, we are very lucky. He's a very, very busy person po. He
Yes.
happens to be the director of the health services ng buong Philippine National Police. He happens
Wow.
also to be the commander of the Medical Reserve Force. Let me now call our most esteemed guest and honor and speaker for this program, Police Brigadier General Luisito Magnaye. Sir,
Wow, welcome to the show, sir. Magandang gabi po. Maraming salamat for staying with us since 5:30 in the afternoon.
Yeah, even though we could see how busy si Sir.
Nakita ko kanina nagkakape
accommodating
si
us.
General eh. May hawak siyang kape kanina, inggit tuloy ako eh.
Marami pa nga.
Ayun, no? Yeah, a lot of
Sir, pag
signing.
kailangan niyo po ng assistant, nandito lang po kami ni DJ Myla.
Yes, I could be your secretary.
Ako rin po yung secretary ng secretary.
To Miss Digel Gail and Myla, our host from the HitRadio 100.7 Manila, tama ba yun?
Opo,
Yes
yes
po.
po, General. Tama po
Yes,
siya.
thank you very much, and to Team PNP, especially the MRF, good evening. We heard a lot regarding the operations of the MRFs, particularly in the area of MOA arena, or conducting swabbing operations. And a lot had been discussed from the what you call this, the history started by my facility manager, Jess Austria Bimowa, and at the same time the deputy commander of the MRF. Then the services given and the facilities to our teams, MRF, both not only for MOA, including PICC and Ultra. But the MRF is not only deployed in that particular area. We have deployment also in other facilities being catered by the PNP. Meron din tayong inaasikaso dito sa loob mismo ng Camp Crame. Ito yung Kiangan, and doon sa facility rin ng NCRPO. These areas, it was discussed by Paulo Acosta a while ago regarding the difference between isolation and quarantine facilities. Dito natin dinadala yung ating mga patients, lalong-lalo na itong ating mga PNP personnel na ikinikater natin para hindi na tayo maging karagdagan doon sa mga hospital sa labas, dahil alam na natin na punong-puno na yung hospitals.
Yeah.
Ito yung mga ano niyan, at ako ay nagpapasalamat at nabigyan niyo kami ng pagkakataon na magkaroon ng sabihin nating tsansa na may pamahagi namin at may paalam sa publiko kung ano yung ginagawa ng ating team, lalo-lalo na ng kapulisan, particularly ito pong team MRF. Ang isang hiling ko lamang sa ating mga kababayan, nais ko lang ipamahagi na for our most respected, beloved brothers and sisters in the community, muli, isang magandang gabi po sa lahat. And to recall the historical timeline of the COVID-19 in the Philippines, it was on March 7, 2020, when the Department of Health raised its alert to Code Red, sub-level 1, after the confirmation of the first local transmission ng COVID-19. The historical incident kicked off with a series of proclamations issued by the President in declaring a state of public health emergency and a state of calamity throughout the entire country. Up to today, some areas in the country are still placed on enhanced community quarantine due to the continued spread and sadly upsurge ng COVID-19 cases. Sinasabi nga nila meron ng mga new variants. Since March 7, 2020, it has already been more than a year that the country is battling the unseen enemy. Figures of infections and deaths continue to increase to this day. Thus, every figure of recovery has always been a hope, especially to our healthcare workers who have long been braving this battle of the front lines. To our team Medical Reserve Force and all the healthcare workers throughout the country who have been in the front line since day one. Allow me to express my heartfelt gratitude for your painstaking efforts to save lives every single day, even if it means risking your own. The lives of our fellow countrymen have always been in constant danger in this time of pandemic. Truly, not all heroes wear capes. Our modern Filipino heroes here wear PPEs. Thank you sincerely. While we are still experiencing the surge of COVID-19 cases at the NCR Plus area, the ECQ is again extended for another week until April 11, 2021. And while the government is exhausting all means to contain the spread infection, each and every one of us in the community can always take on our respective roles that are equally important as that of our frontliners and health workers. It is just as important to acknowledge that every one of us has an indispensable role in the face of this battle. I continue to call on to our fellow Filipinos and appeal to every member of the community to be steadfast in observing the minimum health standards and protocols. Wear your face masks and face shields, observe social distancing, and abide by the guidelines issued by your local governments in our common goal of stemming this disease. At this point in time, our love language for our families should be the strict discipline of observing these minimum health standards and protocols because you would not want to be the cause and source of infection in your own homes, in your families and loved ones. Again, not all heroes wear capes. Many heroes are religiously wearing face masks and face shields to save and protect their families. As they do so, they save and protect the nation. Ito yung ginagawa natin hindi lang dito sa NCR but nationwide. And may I also take this opportunity to acknowledge one of the laudable and timely initiatives of the Chief PNP, General Dimod Sinas, which is the establishment of our station health units in every police unit of the ground. The 219,349 strong PNP is obligated by our own PNP personnel who are at the same time our medical and health professionals, doctors, nurses, psychologists, among others. We also have our hospitals located at Camp Kame and in regional health services nationwide. With this initiative, manpower and facilities in place, we are helping to alleviate other health facilities from an added load as our own health workers can already respond to affected PNP personnel, as I stated a while ago. And gallant brothers and sisters in service across the regions who not only serve as our uniform frontliners, but also our indefatigable health workers. Thank you for your dedication to your work and your profession. Your service is truly indispensable at this time, as you are the ones within reach among our police personnel on the bus grounds across the nations who are also in dire need of your professional services. Yung the rest was already discussed by the different presenter a while ago. And I think all the members of the team for that. And by the nature of COVID-19, the virus can rapidly transmit from one infected person to another in a multitude of ways, especially with the complacency and responsibility of our actions. With this in mind, containment of the infection is a primordial consideration to stem its transmission. Thus, by virtue of Resolution number 15 dated March 24, 2020, issued by the IATF for the management of emerging infectious diseases, stating the adoption of measures for the containment and mitigation of the spread of the virus. And as per Resolution number 32, dated March 4, 2020, issued by the same authority, stating the establishment and operations of 4 mega swabbing facilities, including the Mall of Asia in Pasay. And I, as the Director of the Philippine National Police Health Service and the Commander of the Philippine National Police Medical Reserve Force, assures the continued response to the call to contain the infection and stem its transmission through the identification and isolation of COVID-19 carriers. We also continue to increase public awareness of our medical reserve force through the mega swabbing and quarantine facility, with high hopes that by sharing this broadcast of what has been done and accomplished, we will gain the support of our people to our cause of preventing further infection through detection by swabbing and isolation. Along with the constant painstaking efforts of our medical reserve force and machineries at work in our mega swabbing facilities, hand in hand with the indefatigable service of our frontliners, health workers in the PNP units across the nations, and those in the private and public facilities within the communities. Our committed partners in the private sectors, our community partners in service, initiatives, and unending support of our Chief PNP and other concerned citizens, and with the constant protection of the Almighty, all together, we assure that we will continue to do our best efforts in the name of the service to do our role in waging this battle with the unseen enemy. Again, containment of the virus is the primordial objective to prevent further infection. But this cannot be done alone. We will always need your help and cooperation to do our respective roles in the face of the pandemic, so that together we will heal as one. Thank you. Keep safe at all times so you can keep your family safe all the time. And may the good Lord protect us all. And may the force be with us. Thank you very much, Ma'am Myla and Miss DJ Gail.
Thank you so much,
Thank you.
Police Brigadier General Magnayan. Grabe, naiyak ako sa message ni...
Oo, very
Nakayuko lang ako.
well
kasi,
said.
Oo, kasi syempre, nararamdaman natin yung, of course, yung sentiments din nila. Na mga
Yeah,
tao
of
lang
course.
din sila. But still, they're standing strong, di ba? Rain or shine, nandyan pa rin sila talaga para pagsilbihan,
Yeah.
to
Because
serve our
no
Filipino
matter how
countrymen.
hard they are trying to reach out and spread the
Yeah.
news to everyone, but of course,
That's true.
all viewers, all people here, of course, all over the world, they have to do their part as well. It's really
That's
an
true.
individual responsibility, not only our heroes over there, but it's like everybody, it's individual responsibility. I just hope that they could have all that conscience na they have to do their part. So
That's
that
true.
we have to pray for.
Yes, mga tao lang din tong ating mga PNP, MRF. Natatamaan din ng mga yan, di ba? So, nagkakasakit din. Sabi nga ni Sir Ason, mga tao lang din po kami. Tatamaan din kami ng bala. So, please, let's pray for our PNP, MRF, lalo na po yung sa health service.
Yes.
And again, kung meron po tayong mga extra dyan, kung hindi nyo naman ginagamit, or kung talagang sobra-sobra, mga PPEs and gloves, please po, donate po natin yan sa ating PNP, MRF team dyan po sa SM MOA Arena sa swabbing facility. Ayun po, meron po mag-aasikaso sa inyo dyan just in case po nais nyo pong mag-donate. So again, thank you so much, Brigadier General Magnaye, Philippine Police Major Ace Salvacion. Kanina nailagay ko Asuncion, hindi ko alam kung nasa isip ko. Doc Pau, thank you so much. Ma'am Joy, Ma'am Janelle, Sir Austria, sino pa yung mga kasama natin? Si Ma'am Annabel, maraming salamat po sa inyong oras at para samahan kami dito sa ating Coffee Monday. Please po, abangan nyo po ating next edition, Coffee Monday next week. Sir Ace, it's a promise, di ba? Yan, next week. Abangan nyo po kung ano yung magiging topic natin. So again, let's pray for PNP MRF. We heal as one. Ladies and gentlemen, my name is DJ Gail. Of course, kasama po si DJ Myla dito po sa Hit Radio 100.7. Maraming salamat po sa inyong lahat. Have a blessed Monday, and I'd love to leave this Bible verse from Hebrews 13:20-21, which says, "May the God of peace, that great shepherd of sheep, equip you with everything good for doing His will." Amen. So, ingat po tayo lagi. Stay safe. Don't forget to wear our mask and face shield. And before I play some of our music videos here, Sir Ace, your parting words. Kasi, dahil sa'yo, nabuo tong show na to.
This program, ma'am, will not be ano, ma'am, magkakatotoo kung hindi po tayo pinayagan, ma'am, ng ating director health service. So
Yes.
all thanks to our director who has always been a
Thank you
supporter
po.
for healthcare services. Yung pong motto natin, no, we take care or we care for those who serve and protect. So yun po yung masasabi po natin regarding po dito. So sir, maraming salamat po sir sa inyong support. Hindi po mangyayari po itong program na ito without your undying support for this program. So sir, maraming salamat.
Thank you so much, Sir
Thank you.
Ace. Thank you.
May salute to all the teams of who made an effort for this program. And thank you very much, DJ Gail and Myla.
Thank you po.
Thank you.
It's our pleasure.
General, baka meron kayong gustong batiin, baka may mga nanonood ngayon, yung mga fans nyo. This is a very great opportunity to greet them. Ayan po, sa ating
We have a lot of viewers. So,
Oo, ang dami,
yeah.
napakaswerte. Go ahead
Kung
po.
pagbibigyan nyo ko ng pagkakataon, ang gusto ko lang batiin yung ex-girlfriend ko.
Which is your wife.
Okay. Nako, takot ako dun. Magtatago ako dito. Yari tayo. Yun lang po. Wala na po iba, General. Yung ex lang talaga.
Yung ex lang.
Bukod sa kanya, yung mga anak ko lang, and the rest of the team PNP as a whole, who are continuously doing our best in addressing these issues in this pandemic. Thank you, Beth.
Thank you so much, General. Now, si Sir Austria naman, baka meron siyang mga gustong batiin and meron din siyang mensahe sa ating mga Filipino countrymen. Sir?
Yes, Ma'am DJ Gail and Ma'am Myla. Hinihingi lang po namin yung cooperation po ng public dahil mataas nga po yung ating cases ng COVID ngayon. So we ask for yung solidarity po, yung patriotism, then yung cooperation po ng lahat. Yun lang po, ma'am.
Thank you so much, Sir
Thank
Austria.
you.
What about si Doc Pau? Doc Pau, ano po yung mensahe nyo sa publiko at sa lahat ng mga nanonood ngayon?
Of course, as previously mentioned, please just cooperate because what we are trying to remind you is not just for us, it's for everyone.
Yeah.
Everyone will benefit from this. Think of yourself and you're indirectly thinking of others also by cooperating.
Thank you,
Yeah.
Doc Pau. What about si Ma'am Joy? Ma'am Joy, ano po yung mensahe nyo? At baka meron kayong gusto mga batiin na nanonood ngayon.
Ay, okay. Ulit magandang gabi po sa lahat. So ang message ko lang po para sa public is kumbaga ang MOA Arena swabbing facility, ang MRF swabbing facility ay nandyan para makatulong sa limit or pag-stop ng spread ng COVID virus. So hinihiling din po namin ang cooperation ng public po na maging na sana makatulong din po sa pagsugpo or pag-stop ng spread ng COVID-19 virus by observing yung minimum health protocols natin lagi sa araw-araw. So binabati ko rin po ang Women and Children Protection Center kung saan pong unit ng PNP ako nabilong. Magandang gabi
Thank you
po.
so much. Maraming salamat po ulit sa inyong lahat. See you again next week for another edition of Coffee Monday here on Hit Radio 100.7. Magandang gabi po sa inyong lahat. Enjoy your dinner and don't forget, kape. Goodbye everyone. See you.
Thank you. Keep
God
safe,
bless you
everybody.
all. Thank you. Sir
Thank you.
Ace.
Bye po.
General Bagdaya, maraming
Kay sakit nasaktan at iwanan, sayang ang mga panahon nagdaan. Kay lupit ng iyong ginawa, pinaasa mo ang puso sa wala. Binigay ko ang lahat, ngunit ito ang napala. Liwanag ng buhay biglang nagdilim, pati ang kaluluwa ko'y basang-basa ng luha at naninindig. nagkamali ako nang kita'y minahal. Hindi ko naisip na may katapusan. Ang pag-ibig mo inalam. Akala ko ito'y panghabang buhay. Tulad ng pagmamahal sa'yo, ibinigay na kahit wala ka na, hindi nahihimlang. Umaasa pa rin sa muli mong pagdating. Isang gabi para muling makapiling. Sana ako na lang ang iyong minahal. Sana ako na lang ang iyong pinili. Sana ako na lang ang pinagpalaw. Sana tayo na lang ang magkasama. Sana ako na lang ang iyong minahal. Sana ako na lang ang iyong pinili. Sana ako na lang ang pinagpalaw. Sana tayo na lang ang magkasama. Sana ako na lang ang iyong minahal. Sana ako na lang ang pinili. Sana ako na lang ang pinagpalaw. Sana tayo na lang ang magkasama. Sana.
Why can't you believe me when I try to tell ya you're the only one I adore?
So you think I'm crazy if I don't believe you when you know I've heard it before.
I've never strayed, I've always been here for always. And you know it's true. If you told me once, then I told you twice. I only want to be with you forever. And nothing's changed, so why not sit for a minute? There's really nothing to it. Just give me a chance to explain.
If all the ifs and buts were simply candy and nuts, you'd probably think they're all just the same.
I've never felt the way I'm feeling. and it's only you. If you told me once, then I told you twice. I only want to be with you forever, and nothing's changed. So why do we play silly games? Why do we always find a way to anger each other each time when there is no one else but you? When times went bad, we had our love to lean on. Shouldn't that be enough to carry us through? You know that I will always be here forever, and you know that's true. If you told me once, then I told you twice. All I wanted was just to be with you, and nothing's changed. So why do we play silly games? Why do we always find a way to anger each other each time when there is no one else but you? Why can't you believe me? Tell me that you love me. All I ever wanted was to have you in my life.
All I ever needed was someone I could lean on. Will our love survive, or will we always wonder why? Do you think I'm crazy
Oh, why can't you believe me, honey?
if I don't
Oh,
believe you?
you're the only one I adore.
When you know I've
Tell
played
me
it before.
why. Oh, why?
Nothing's changed, so
Why?
you simply candy enough.
Tell me why.
Broadcasting live via zeno.fm/hitradio online. This is HRO Hit Radio Online. Hit Radio Online.